girl Tanya, back at again with another video. I know it's been a minute. Your girl has been working, your girl has been studying, your girl has been doing a million things at once, but I felt the need to sit down and make this video for you guys because everybody in my Instagram has been asking me about what to study for HESI, how to prepare for HESI, tips on HESI. So I go to Nightingale College, and I know a lot of my subscribers and followers on Instagram also go to Nightingale College. I'm starting to build a little Nightingale community over here, but I know that all of us are taking HESI this week and next week, depending on what class you're in, and everybody's nervous, everybody's like trying to study the right thing. I can't necessarily tell you what to study because, like I said, everybody's in different classes. I'm just gonna give you guys tips on what to look for in the question and just test taking strategies, because to be honest, girlfriend, what I've learned so far in this program and just nursing school in general is it's all about, yes, knowledge, like knowing your shit, but it's mostly about test taking strategies. Like once you learn how to take the test, you will be successful in every single HESI or NCLEX that you take, because the HESI is basically just preparing you for the NCLEX. And for those of you who don't know what the HESI is, I mean, if you're watching this video, I'm sure you know what the HESI is, right? But I'll just explain. So the HESI, sorry, I'm trying to get this. Okay. The HESI is a nursing exam that different nursing programs will use. Some nursing programs will use it as an entrance exam to get into their program, and other nursing programs will use it as like a final exam for their nursing courses. So in my program at Nightingale, we have HESIs for fundamentals, pharmacology, med-surg, maternity. So basically like the hardcore nursing courses are the ones that are gonna have HESIs. Some of the nursing courses don't. Thank God, not all of them do, because I would go crazy. So for me, I'm taking my maternity HESI next week, and then next semester I take my exit HESI, which is crazy. So the exit HESI is the very last HESI. After that one, I am done with that, and I am focusing on NCLEX. So anyways, let's just jump into the tips. I wanna make this short and sweet because I know some of you guys are taking your exams this week. So I know I haven't been making a lot of videos, but I just wanted to like throw one together really quick for you guys. I hope this will help. Okay, so the first thing that you need to do is read the question twice. I know this sounds like this is gonna take you forever, but I personally, I take all the time that they give me. I know they usually give you 3 hours. I take the full 3 hours, and it's not because I'm dumb or because I'm slow. I just literally read the question twice, because sometimes when you read the question the first time, it might sound like you know what it's asking, but then you don't really know what it's asking, because the test is made to trick you. HESI and NCLEX are made to trick you. It's made to test your critical thinking skills. So sometimes you might read the question and it might sound like something that you know, and then you just go to the answer that you think that it is. But then if you go back, the wording might be different. They might add something in there that you're not familiar with. So read the question twice, read all of the answers. Don't just go with the first one. Make sure you know what the question is asking. So you have to tell yourself, what is the question asking? Is this a prioritization question? What is it that they're asking from me? Do they want to know which patient I should see first? Which patient should I see last? So for prioritization questions, you're going to have to think ABCs. That's the first thing. You're going to think ABCs. Okay, which patient is more critical? ABCs. Airway, breathing, circulation. What's going to kill them first? So you have to go in that order: airway, breathing, circulation. Okay, so when you kind of classify the patients on which one is more important, like which situation is more important, like a respiratory issue, or the patient has an infection, the patient has a fever, which situation is going to kill the patient first? Go with that. And then you're going to go with Maslow's law of hierarchy. So study Maslow's, because especially in fundamentals, you're going to need to know Maslow's. You're going to need to know what issue is more important than the other. So is there safety? Obviously safety is always going to be first. That's another thing. Safety is always right. Okay, anything that affects the patient's safety, that is going to be the right answer. So Maslow's, I don't know Maslow's by the top of my head, which I should, but I'm so sorry, I don't know it, but look it up. I'm going to actually probably maybe put it in here somewhere so that you guys can really study that. Okay, so Maslow's, I think it's like something like food, shelter, love, I don't know. I'm going to put it in because, to be honest, I don't remember. But definitely like memorize that so that way you know how to classify the patients. And then think of your time frames. So some patients are more critical if they just came out of surgery. I'm sorry, there's an airplane. Let's just ignore the airplane for a second. Freaking airplane. Okay, like I said, time frames. So some patients are more critical than others because they just came out of surgery. So a patient that just came out of surgery is always going to be more critical than a patient that's getting ready to be discharged, or a patient that has been stable for a day or two. So if they just had surgery, that you're going to see that patient first. Remember that. So if you have a patient that has like a chronic illness, that patient can wait because they have something that is chronic. They have something that can wait. The patient that just got out of surgery has a higher chance of infection and has a higher chance of their vitals to go down. So the next thing is stability. That's what Dr. was talking about. So think of the patients in order. Which one is stable? Which one has been stable? Has anything changed? A patient that has vitals that has changed recently needs to be reassessed. So therefore, you need to see that patient first. So you kind of really have to use your critical thinking, and a lot of this stuff is common sense, but we miss it because it's too much common sense that we think that we have to like really analyze the question or really break the question down. But in reality, you don't need to do all that. You really just need to use your common sense and think which patient is stable, which one is going to go down first, which one do I need to see first. And then again, safety. So safety, the test is basically all about safety. Just think about that. The HESI and the NCLEX is tests to see if you are a safe nurse. It's a test to see if you are going to keep your patient alive and keep the patient safe. So that is the biggest thing, because what the nursing board wants is safe nurses. They want nurses that are going to do the right thing and that are going to be smart enough to intervene when there's something unsafe, right? So just think about that. Always look at the question and say, is this a safety question? Are they testing my knowledge on safety? Are they testing my knowledge on Maslow's? Are they testing my knowledge on ABCs? Like, think about what they're asking you and what the question is entailing. Okay, so the next thing is delegation. So I notice a lot of the HESI questions have to do with delegation, and I noticed a nurse's job has a lot of delegation, which is kind of crazy because I'm like the worst person to delegate stuff because I'm like super nice and I just want to do everything on my own and I don't want to bother anybody. But I need to stop that because nursing is about delegating. That's why you have people underneath you. You have CNAs underneath you, you have LPNs underneath you, you have MAs underneath you. And the reason is because everything works as a team. So the nurse obviously can't do everything. It's impossible. Just like the doctor can't do everything. That's impossible too. The nurse needs people underneath her to delegate so that way everything can run smoothly and everyone can work as a team. So therefore, the NCLEX and the HESI are going to ask a lot of questions on delegation because they want to make sure that you as a nurse knows when to delegate and when not to delegate. So I'm going to just give you guys a few things that unlicensed assistant professionals can do. So the HESI and the NCLEX talk about UAPs. So UAPs are unlicensed assistant personnel. Basically, anyone that doesn't have a license. So it would be a CNA, an MA, a patient tech or patient care tech. You know what I'm talking about. So those people, the UAPs, which is what you're going to see in the test, those people can feed the patient. They can take vital signs. Taking vital signs is perfectly fine without a license. They can transport the patient. They can measure output, urine. They can obtain a urine sample. They can transfer the client from the wheelchair to the bed. They can perform range of motion exercises. So these are things that the UAP can do. So you need to know what they can and cannot do, because when you get a question that's asking you about delegation, you need to be able to eliminate the things that they can't do, right? So the LPN obviously has a larger scope than the UAP. The LPN is a licensed practitioner nurse. There's another airplane. These airplanes are like ruining my videos, I swear. I promise this is the last video I'm gonna do outside. I'm just having like issues inside my house. That's why I'm out here, but okay, the airplane is gone now. All right, the LPN, things that LPNs can do. And this is where it gets kind of tricky, because sometimes you think that an LPN can do it and they can't, or you think that an LPA can't do it and they can, because LPNs and RNs are very similar. Of course, RNs have a bigger scope, but there are certain things that they can both do. So you have to know the scope of the LPN, not just of the RN. So they can administer medication orally. They can administer IV medication, piggyback like secondary medication. They can calculate and monitor the IV, the flow rate. So they can do a lot of things with the IV. And then again, it depends on the protocol of wherever you work. But for NCLEX, you need to know like the standard, right? They can count narcotics, things like that. They can insert a straight urinary catheter. They can perform nasal oral suctioning. They can insert nasogastric tubes. They can change a G tube. They can give feedings through an NG tube. They can assist with perinatal dialysis. They can assist with hemodialysis. They can administer oxygen. They can document in the medical record. They can reinforce teaching. So here's the thing. LPNs can reinforce teaching, meaning that they can repeat what the nurse has already taught the patient. So LPNs are not allowed to establish new teaching to the patient. So if you get a question that says, oh, the LPN is going to go in the room and teach the patient for the first time this. No, the RN has to do everything for the first time. The RN has to assess the patient for the first time. The RN has to teach the patient something for the first time. So anytime you hear first time, you know that's going to be the RN and not the LPN. And then so here are the things that the LPNs cannot do, so that you remember if this is a task, it needs to be done by the RN. So push any medication through the IV. So no IV push. Give medications through central lines. Give TPN. TPN is like supplements that they give through the IV. Independently develop a plan of care. Independently plan and provide patient-family education. That's exactly what I just told you. Make changes to the plan of care. Basically, there's a lot of things that the LPNs cannot do, and those are the things that we need to be aware of, so that we make sure that we do not delegate that to the LPN. So basically, the RN is responsible for patient assessment, planning care, determining appropriate nursing diagnoses, identifying appropriate nursing interventions. So we're in charge of intervening, performing patient teaching, like I had said, performing tasks that are invasive. So basically, you need to know how to prioritize. You need to know ABCs. You need to know your Maslow's. You need to know delegation. You need to know your lab values, which is kind of difficult because there's so many, but you should know like the main lab values. So let me go over some main lab values that you should probably know. Your arterial blood gases. This is fundamentals right here. Arterial blood gases, like your pH levels, you should know that. Your CBC count, you should know that. You should have a general idea of like your normal ranges. So I'm gonna try to maybe put something up here so that you guys have it. Or you can look it up yourselves. Chemistry, cholesterol, just like your main lab values. Like, just, it's hard to memorize all of this stuff because we can't possibly know it all. Like, we're not gonna be doctors, so we don't need to know it all, but you need to have an idea of what's normal and what's not normal, because a lot of these questions, it's like if you know your lab values, you'll know how to answer the question. So this is how I see it. Like, most of the questions are knowledge based, where you have to know something to answer the question, and some of them you can literally get the right answer without knowing what the hell they're talking about with test taking strategies. Like, it's so weird. Like, you could literally just eliminate all the ones that are wrong and end up with the right one without even knowing what it is that they're talking about, because I've done that a lot. So it's test taking strategies and knowledge base, pretty much, and common sense. Like, those three things: test taking strategies, knowledge base, common sense. That's all it really is. Let me see if I just wrote down some notes, so I'm gonna see if there's anything else. Dosage calculations. If you're taking pharmacology, HESI, that's a whole nother story, girlfriend. Like, that's a whole nother video. Pharmacology HESI 1 is all med calculations. Pharmacology HESI 2 is all reactions and basically like what the medication does, durations, all of that stuff. So that is a whole nother video. This video is mostly like fundamentals, med surg, things like that. Mental health, you have to know like restrictions, like when you can restrain a patient, when you cannot restrain a patient. You need an order to restrain a patient, and the order needs to be renewed every so often. I think it's like every 24 or 48 hours, things like that. Therapeutic communication, you need to know how to be able to speak to a patient. A lot of the questions are going to ask you, the patient said this, this, and this. How would you respond to the patient? And this is kind of tricky because we all have different personalities. We would all respond differently, but you need to know what is the best therapeutic response. So most of the time it's going to be something like, I'm sorry you're feeling this way. Tell me more about this. Pretty much. Like, it's really dumb because sometimes you would not say that, but in NCLEX world, and I'm sure you heard a lot of people say NCLEX world, and that's pretty much how it is in a perfect ideal world, not how it is in real life. So you need to know how to respond to the patient. What is the best therapeutic response for the patient? So when you get these questions, look at each response and think, which one is the best therapeutic response? Which one is the response that's going to either calm the patient down or not solve his problem, because you can't solve the problem. Don't give out promises. Don't ever say, oh, everything's going to be all right. That's a big no-no, because we don't know that. Kind of just let the patient vent and be understanding. That's pretty much it. Professional behavior. A lot of the questions are going to ask about your coworkers, about HIPAA, about what's professional and what's not professional. Just remember that if it's breaking the law, it needs immediate attention. If they're not breaking the law, it can be something that can be addressed after the shift, or something that you can speak to your supervisor or your charge nurse about. Think about that. And also think about, if it's hurting the patient, you need to intervene right away. So for instance, if you catch your coworker clocking in like a little early, is that hurting a patient? Not really. Is that illegal? Kind of, but not really. So that's something that you can maybe talk to that person later about, or maybe talk to the supervisor about it. Say if you see a nurse giving the wrong medication to the wrong patient, is that illegal? No. Is that hurting the patient? Yes, that's hurting the patient. You need to intervene right away. So like I said, all of this stuff is common sense, but the way that the way they word it will try and trick you. When to notify your healthcare provider. So a lot of the questions will say, this and this is happening. What would you do? Blah, 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 blah. The last answer is call the doctor. So here's the thing. You call the doctor either if it's like life or death, like emergent, like there's nothing that you can do. Remember, you only call the doctor when there is nothing that you can do within your scope. If you have done everything within your scope, then yes, call the doctor. My phone literally just died and I had to steal my daughter's phone. So anyways, I was basically just wrapping up anyways. So I was talking about when to call the doctor. So you only call the doctor when you have done everything in your scope, everything that you can possibly do for that patient. And then you call the doctor. If it's something out of your scope, you call the doctor. That's just simply how it is. Like, have you assessed the patient? Have you done this? Have you done interventions? Because before you call the doctor's going to want to know, what did you do for the patient? What did you do to help fix the situation? And of course, if it's outside of your scope, it's outside of your scope. So let me just make sure there's nothing else. I think that's pretty much it. I covered a lot, like more than I thought I was going to. I've taken these HESI exams a lot, and I know the first time you take it, it's kind of scary because you don't know what to expect. But like I said, it's all test taking strategy, knowledge base, and common sense. Okay, you got this, girlfriend. I'm here for you. You guys can message me, of course, whenever you want. If you're not following me on Instagram, girlfriend, I don't know what you're doing, but you have to follow me on Instagram at the Pink Nurse Dream. Good luck to everybody. Don't forget to subscribe. Don't forget to like. Leave me some love. I love you guys back. All right, good night, guys. God bless you. Bye.